She lost 125 pounds, but that's not the best part. Sally didn't just lose weight, she got her life back. When I first met Sally, she was 57 years old. She weighed over 300 pounds. She had just been diagnosed with type 2 diabetes. Her joints were constantly inflamed and hurting due to inflammation caused by rheumatoid arthritis. And she told me something I hear far too often: I don't recognize myself anymore. Fast forward to today, she's 60 years old, 125 pounds lighter, off several medications, and doing things she never thought she could do again. But here's the part we all need to understand: weight loss isn't just about one right decision, it's a journey. And I want to share with you Sally's health and weight loss journey step by step. Let me take you back where it all started. When Sally first came to see me in November 2022, she was struggling, not just physically, but emotionally. She had rheumatoid arthritis. This is an inflammatory arthritis, and she was constantly in pain. Her hands, her back, her feet, it was almost unbearable sometimes, despite strong immunosuppressant medications and steroids. She had hypothyroidism or low thyroid that wasn't very well controlled. She also had high cholesterol and a new diagnosis of type 2 diabetes with hemoglobin A1C of 7.3. She was working as a home health nurse, taking care of others while her own health was suffering. At her first appointment, she was 303 pounds, 5 feet 4 inches tall, with a BMI of 52. This was her highest adult weight. Even basic things were becoming difficult. She told me, by the end of the day, I'm exhausted and in pain. And what scared her the most was her recent diagnosis of type 2 diabetes. She was taking care of so many patients who were homebound due to complications of diabetes. And then she got the diagnosis herself and felt so helpless and scared. So the question becomes, where do you even start when everything feels so overwhelming? The first step is lifestyle. First of all, I told Sally, you're not alone in this, and this is something we can manage step by step together. We don't need to change everything overnight. Let's start simple. When you eat, try to build your meals around protein, like eggs, chicken, fish, or lentils, and add some fiber, like vegetables or whole grains. This helps keep your blood sugar steady and keeps you full longer. Try to cut back on sugary drinks, juices, and highly processed foods because those can raise your blood sugar quickly. Even a short walk after meals, just 10 to 15 minutes, can make a big difference in your blood sugar. And also, sleep and stress matter more than most people realize. So, getting good rest, good night's sleep, and finding small ways to relax during the day can really help. I also talked about checking blood sugar periodically, not to stress her out, but to help her understand how her body responds to different foods and different stressors. I emphasize that you don't have to be perfect. Small, consistent changes over time are what really work. Second step was medications. We started with Ozempic after discussing all available options at that time. Remember, that was back in November of 2022. The decision to start Ozempic was not just for her diabetes, but for her weight as well. We started low, 0.25 milligram Ozempic weekly, and then increased to zero point 0.5 at her 1 month follow-up. At her 2 month follow-up, something encouraging was already happening. She had lost around 16 pounds and her blood sugar had improved. But more importantly, she felt hopeful again. But Sally wanted more. She wanted a bigger change. She was scared due to her recent diagnosis of type 2 diabetes. She was scared of developing diabetes related complications, as she had seen several homebound diabetic patients with complications like circulation issues leading to amputation, or blindness or kidney failure needing dialysis. As a home health nurse, Sally had seen several different complications of diabetes and how it had a negative impact on both physical and mental health. She asked me about bariatric surgery. Unfortunately, her insurance did not cover weight loss or bariatric surgery. So she made a difficult decision. She paid out of pocket as her health was her topmost priority at that time. In July of 2023, she had gastric sleeve surgery. And over the next year after her gastric sleeve, she lost about 95 pounds with close monitoring with her bariatric surgery team. Now, this is where many people think the story ends, but it doesn't. Because weight loss is not a one time event, it's a long term process. 1 year after surgery, her weight loss slowed down. Then came the dreaded weight loss stall. And this is exactly where many people feel stuck again. She decided to come back and see me again in July 2024, exactly a year after her bariatric surgery. We restarted GLP-1 treatment, first back on Ozempic, then transitioned to Mounjaro in October of 2024. At that time, she weighed 196 pounds, still a huge improvement, but we knew she could go further. We slowly increased her dose of Mounjaro from 2.5 to 5 to 7.5 to 10 and then to 12.5 milligram. And I discussed the need for adequate protein, fiber, and strength training to optimize medication benefit. And something interesting happened on Mounjaro. Not just more weight loss, but stability. Her hunger was controlled, her energy improved, and she started living differently. This is the part I want you to hear because this is not just about numbers. Sally told me things like, I can finish my workday without pain. I'm not afraid to move anymore, and I can actually play with my grandkids. As a home health nurse, she used to struggle caring for patients, but now she moves more easily. She feels confident again. She enjoys her job again. She told me recently, I feel like I'm finally living, not just getting through the day. So, where is Sally today? At her most recent visit a few weeks back, she weighed 177 pounds with a BMI of 29.4. Let me remind you, her starting BMI was 52 with a weight of 303 pounds. Total weight loss since November of 2022, 125 pounds. At her last follow-up, she was doing well, but weight loss stalled on Mounjaro 12.5 milligram dose, as she had been on this dose for a few months now. So I increased her dose to the highest dose of Mounjaro, 15 milligram weekly, and she'll come back for a follow-up next week, and we'll see how things are going. So an impressive 125 pounds weight loss with help of bariatric surgery, Ozempic, and now Mounjaro, combined with a healthy lifestyle. This is not the only win though. Let me show you her other health improvements. Look at this. Her hemoglobin A1C dropped from 7.3 to 5. Cholesterol numbers improved dramatically. Her thyroid is now controlled, and rheumatoid arthritis, no recent flare-ups, and she is off rheumatoid arthritis medications. This is not just weight loss, this is metabolic transformation. So, what made this all work? Sally's success didn't come from one thing, it came from a combination of medication support, surgical intervention when needed, adjusting medications when progress slowed, long term follow up, and patience through plateaus. Now, this is important because many people think if one thing doesn't work, I have failed. That is not true. Sometimes you just need the next step. Here's what most of us don't realize: weight loss is not linear, it's stepwise, adaptive, and evolving. Sally didn't fail when she plateaued. Her treatment just needed to evolve. Here's the big picture reflection. Sally is now 60 years old, and she told me something recently that stuck with me. I feel stronger now than I did 10 years ago. Think about that. Not younger, but stronger. That's the goal. Not just losing weight, but regaining your life and your strength. So if you're watching this and thinking, I have tried everything, maybe things haven't worked as expected, this doesn't mean you failed. Maybe your plan just needs to change because there is no single path. There's just the next right step. If this real patient weight loss journey resonated with you, subscribe and I'll keep sharing more life-changing and inspiring stories. Also, I would love if you can comment below on topics you would like to hear about. Stay happy, stay healthy and well, and I'll see you in the next video. Bye for now.